Chairman Lee, Vice Chair Beyer, and distinguished members of the Joint Economic Committee, thank you for the opportunity to testify today. The Indiana University Lilly Family School of Philanthropy has tracked crises and disaster giving since September 11, 2001. I will share initial evidence about philanthropy's response to the COVID-19 pandemic. Through good times and during times of crisis, American philanthropy, which includes donors at all income levels and racial and ethnic backgrounds, has collaborated to fill gaps where governments and markets face limitations and provide capital for innovation and meet material and spiritual needs. Philanthropy, defined as voluntary action for the public good, is a core value, a central way for Americans to contribute to the vitality and strength of their communities. In 2018, Americans donated about $427 billion to charitable organizations, of which 68% came from living individuals. Four aspects of the philanthropic response deserve close attention. First, the COVID-19 pandemic has induced twin crises, and Americans are grappling with unprecedented health and economic shocks. African American and Latino populations have been disproportionately impacted, exposing deep racial and structural inequities. In response, we've witnessed tremendous individual giving during the COVID-19 pandemic to charitable organizations, but also mutual aid to neighbors and friends. Beyond individual giving, U.S. foundations and corporations have contributed over $11 billion to the COVID-19 response based on Candid's estimates. Second, philanthropy's innovative response has included cash and in-kind donations from everyday citizens and donations from wealthy donors. Crowdfunding campaigns, typically driven by small donations, have expanded in their reach and impact. One of the most extensive GoFundMe campaigns, America's Food Fund, has raised over $26 million to combat food insecurity, and the CDC Foundation has raised $50 million on charity.com. Third, in the wake of the COVID-19 pandemic, we've also seen philanthropy as a unique collaborator and facilitator of collective action in local communities. A research initiative led by Dr. Lori Paulberg at the Lilly Family School is tracking philanthropy's facilitator role at the local level. As of May 15th, her mapping project estimates that community funds in cities and towns across America have raised $634 million and distributed at least $376 million to address critical needs created by the pandemic, including food insecurity, mental health, and emergency financial assistance. Finally, we've seen philanthropy tackle systemic issues of inequality. In Michigan and here in Indiana, a collaboration of philanthropic organizations in each region rapidly joined forces to supply computer tablets with high-speed internet connectivity to address the digital divide for K-12 students. The initial response to COVID is unprecedented in its speed, size, and scope, and nonprofits of all sizes have risen to the challenge. However, the need for private philanthropy is rising as many more people and communities need support, and at the very time when the ability of many donors to give is challenged. Research established that charitable giving is linked to national and regional economic trends. A concerning trend is that the share of American households that give to charitable organizations has declined significantly, from 66% in 2000 to 53% in 2016. Declines in participation rates among low and middle income Americans, as well as younger Americans, have been evident since the Great Recession. This trend of declining participation has implications for the strength and vibrancy of civil society. Over time, tax policy has also provided less tax recognition of the giving by all Americans, especially the giving of low and middle income Americans. The charitable deduction is one of the oldest tenets of the US tax code and affirms the value our society places on voluntary giving. The school has analyzed the impact of various policy options. Our studies project that extending the non-itemizer deduction could increase charitable giving available to nonprofits by up to $26 billion, an increase of about 7.7%, and also increase the number of donor households by an increase of 8.2% in 2021, enabling a fairer, more inclusive, and more engaged civil society. To meet the complex challenges triggered by COVID-19, creating tax incentives that encourage the generosity of all Americans, including lower and middle income households, is a vital step in the recovery, given the mounting needs of families and communities. Thank you for the opportunity to testify today. I would be happy to respond to any questions.